11 warning signs of lung cancer. Lung cancer, one of the leading causes of cancer deaths worldwide, can be difficult to detect in its early stages. Early detection is crucial for improving treatment outcomes. Here are 11 early warning signs of lung cancer. 1. Persistent cough. A persistent cough that does not go away or worsens over time is a hallmark early warning sign of lung cancer, although it can also be a symptom of many other conditions. Unlike the cough associated with a common cold or respiratory infection, which typically resolves within a couple of weeks, a persistent cough related to lung cancer does not improve with time. It can be either dry or it might produce sputum. A persistent cough can be caused by a tumor irritating the lining of the airways, obstructing airflow, or causing inflammation. As the tumor grows, it can exert pressure on surrounding tissues, leading to irritation or invasion of airway structures, which triggers the cough reflex. A dry cough in lung cancer patients might indicate the presence of a tumor in areas of the lung that do not produce significant mucus. In contrast, a productive cough, especially with abnormal sputum, can suggest that the tumor is affecting the mucus-producing glands or airways. 2. Change in the sound of cough. Changes in the sound of a chronic cough are significant symptoms that should not be overlooked, as they can indicate underlying issues within the respiratory system, including lung cancer. This symptom can manifest in various ways, including increased frequency of coughing, a deeper or more resonant cough sound, or a hoarser quality to the cough. A deeper or more resonant cough sound can suggest that a mass, such as a tumor, is affecting the way air moves through the lungs and airways. This change in sound can result from alterations in the lung's architecture or from the presence of fluid or a solid mass within the lung parenchyma. The lung and airway tissues can alter the cough's sound characteristics by changing the vibration patterns during the cough. A deeper cough might suggest an obstruction or a change in the lung's typical air spaces, possibly due to a tumor or fluid accumulation. Hoarseness or a change in the voice quality associated with coughing can indicate that a tumor is impacting the nerves that serve the vocal cords, particularly the recurrent laryngeal nerve, which can be affected by lung cancer, especially in the left upper lobe. Lung tumors, especially those located near the larynx or along the path of the recurrent laryngeal nerve, can cause partial paralysis or dysfunction of the vocal cords, leading to hoarseness. 3. Mucus and cough. Lung cancer can lead to increased mucus production as the body attempts to protect and heal the respiratory tract. Tumors in the airways can irritate the mucosal lining, causing the glands to produce more mucus than normal. This is often an attempt to trap and remove foreign particles, including cancer cells. The mucus, which can be clear, white, yellow, or green, might be more noticeable and persistent than the mucus produced during a common cold or other respiratory infections. Increased mucus production can also lead to a chronic cough, as the body tries to expel the excess mucus. 4. Blood in cough. Hemoptysis, or coughing up blood, is a more alarming symptom that can be associated with lung cancer. It occurs when cancer cells invade and damage blood vessels within or near the lungs, leading to bleeding. The amount of blood can vary from small streaks to larger amounts mixed with mucus. Coughing up blood is a sign that the cancer may be at a more advanced stage, or that it has caused significant irritation or damage to the lung tissue and blood vessels. It is critical to seek medical attention immediately if this symptom occurs. If you find this information helpful, we encourage you to show your support by liking this content, subscribing to our channel, and enabling notifications for the latest health and nutrition tips. 5. Breathing changes. Breathing changes, including shortness of breath and wheezing, are critical symptoms that may indicate the presence of lung cancer. Shortness of breath in lung cancer patients can result from several mechanisms. A lung tumor can physically obstruct an airway, partially or fully, preventing the normal flow of air and leading to difficulty breathing. Additionally, lung cancer can cause fluid to accumulate around the lungs, pleural effusion, compressing the lung and reducing its capacity to expand during inhalation. Dyspnea may initially be noticeable only during physical activities, but can become more apparent at rest as the disease progresses. The onset of shortness of breath during activities that were once easy is a particularly concerning sign that warrants medical evaluation. Wheezing is a high-pitched whistling sound made while breathing. It's typically associated with narrowing of the airways. In the context of lung cancer, a tumor located in or near an airway can cause partial obstruction, leading to turbulent airflow and the characteristic wheezing sound. While wheezing is commonly associated with conditions like asthma or chronic obstructive pulmonary disease, COPD, its onset in individuals without a history of these conditions, especially if accompanied by other symptoms, should raise concerns for lung cancer. Lung tumors can lead to the accumulation of fluid in the pleural space, the thin gap between the lungs and the chest wall. This fluid accumulation can compress the lung, restricting its ability to expand fully during inhalation and causing shortness of breath. Patients with a pleural effusion may experience a rapid onset of breathlessness, chest discomfort, and a dry cough. 6. Chest pain. Chest pain associated with lung cancer is a critical symptom that can significantly impact a patient's quality of life and indicate the disease's progression or involvement of specific structures within the chest. Chest pain in lung cancer patients can present in various forms. It may be sharp and stabbing, dull and aching, or even a constant pressure. The pain can vary in intensity and may be intermittent or persistent. Certain actions that involve movement of the chest wall or diaphragm, such as deep breathing, coughing, or laughing, can exacerbate the pain. This increase in pain with movement or respiratory efforts is due to the additional pressure or stretching of affected tissues in the chest. The growth of a lung tumor can lead to chest pain through several mechanisms. A tumor can press directly against nerves, bones, or other structures within the chest, causing pain. This is particularly true for tumors located near the chest wall or the pleura, the membrane covering the lungs. Lung cancer can lead to the accumulation of fluid in the pleural space or cause inflammation, both of which can produce chest pain, especially during respiratory movements. Lung cancer that has metastasized to the bones of the chest, such as the ribs or spine, can cause significant pain, reflecting the tumor's aggressive nature and advanced stage. 7. Weight loss and loss of appetite. Unexplained weight loss, losing weight without trying, and loss of appetite can be signs of lung cancer. Cancer cells can consume a lot of the body's energy, and the immune response to cancer can also lead to decreased appetite. 8. Fatigue. Feeling unusually tired or weak without a clear reason can be a symptom of lung cancer. Fatigue associated with cancer is not relieved by sleep or rest and can be severe. 9. Recurring infections. Recurring infections, such as bronchitis, pneumonia, or other respiratory infections, can sometimes be a sign of lung cancer. This association is particularly concerning when infections become frequent and recurrent, pointing towards an underlying issue affecting lung health and function. Lung tumors can grow to a size where they block part or all of an airway. This obstruction can trap bacteria, viruses, or particles in the lungs, leading to infections. Additionally, the blockage can prevent the clearance of mucus and pathogens, creating an environment conducive to infection. Lung cancer can impair lung function in various ways, including reducing lung volume and affecting the lung's ability to exchange gases efficiently. This impairment can weaken the body's ability to fight off infections, making respiratory infections more frequent. The types of recurring infections that can occur are bronchitis, which is an inflammation of the bronchial tubes, which carry air to and from the lungs. Symptoms include coughing up mucus, wheezing, shortness of breath, and chest discomfort. And pneumonia, an infection that inflames the air sacs in one or both lungs, which can fill with fluid or pus. Symptoms include cough with phlegm or pus, fever, chills, and difficulty breathing. 10. Swelling of the neck and face. Superior vena cava syndrome, SVS, is a serious condition that can arise in patients with lung cancer, particularly when a tumor is located in the upper right portion of the chest, near the superior vena cava, SVC. The SVC is a large vein that carries blood from the head, neck, upper chest, and arms back to the heart. Lung tumors, especially those originating in the right upper lobe, can grow to exert pressure on the SVC, leading to partial or complete obstruction. This obstruction prevents normal blood flow, causing blood to back up in the veins. The body attempts to compensate for the obstructed blood flow by rerouting blood through smaller collateral veins. However, these veins can become overloaded, leading to increased venous pressure and subsequent swelling in the areas drained by the SVC. The most noticeable symptom is swelling, edema of the face, neck, upper chest, and arms. This swelling can be gradual or rapid in onset, depending on the speed at which the SVC is obstructed. Shortness of breath is common, often resulting from increased pressure in the chest and impaired venous return to the heart. A bluish discoloration of the skin, particularly around the face, can occur due to decreased oxygenation of the blood. Veins in the chest, neck, and face may become more visible and distended as blood attempts to return to the heart via alternate routes. 11. Clubbing of fingers. Clubbing of the fingers is when the area around and under the fingernails changes, making the tips of the fingers look different. It's a sign that might point to diseases, mainly those related to the lungs and heart, and it could indicate problems like lung cancer. The cause most likely has to do with changes in the blood vessels and growth of the tissue at the end of the fingers, which makes more blood flow to the fingertips and changes the way the nail bed looks. In cases of lung cancer, clubbing might be linked to having low oxygen levels in the blood for a long time because tumors can make it hard for the lungs to work properly. There's also a thought that certain substances made by tumors could cause clubbing by helping to create new blood vessels and changing the tissue around the nails. Normally, the area under the nail makes a small angle with the cuticle, less than 180 degrees. With clubbing, this angle gets bigger, making the nail look more curved. The ends of the fingers might look more round and swollen, similar to drumsticks. This happens because the tissue under the nail gets thicker. There's a simple way to check for clubbing called the Shamroth's window test. You press the tips of the same fingers from opposite hands against each other. Usually you'll see a small diamond-shaped space between the nails. If that space isn't there, it could mean clubbing. It's important to note that many of these symptoms of lung cancer can also be caused by other conditions. However, if you experience any of these symptoms, especially if they are persistent or worsening, it's crucial to consult a healthcare provider for a thorough evaluation. Early diagnosis and treatment can significantly improve outcomes in lung cancer. Thank you for watching 11 Warning Signs of Lung Cancer on Healthy Vibrance. Don't forget to like, subscribe, and turn on notifications. Our goal is to bring you the best health content because our wish for you is to be healthy and vibrant. See you in the next video.